Welcome to the First Aid Show Daily Minute Podcast, your daily dose of first aid, brought to you by Australia's first and only first aid conference and exhibition, the First Aid Show.
You've probably seen it before, that little clip placed on a finger with numbers lighting up on the screen. That device is a pulse oximeter and it's measuring something called SpO2. So what does it mean? Well, SpO2 stands for peripheral capillary oxygen saturation. In simple terms, it estimates how much oxygen your red blood cells are carrying around the body. Because oxygen is life. Your brain, your heart, your organs, everything depends on it. A pulse oximeter gives us a quick, non-invasive reading, usually by clipping it onto a finger. No needles, no pain, just useful information. So what's normal? Well, 95 to 100% is considered normal for most healthy adults and children. Some older adults may sit around 95%. When readings begin to drop 90 to 94%, that may suggest breathing or circulation problems. And below 90% is generally concerning and needs urgent medical attention. Now, once upon a time, first aiders would often routinely give oxygen from a cylinder for many unwell patients. Well, that practice has changed. Today, supplementary oxygen is guided by SpO2 levels and the patient's condition, and in first aid settings should only be given if you're trained, authorised and equipped to do so. It's routine to use oxygen when oxygen saturations fall below 94%, but local protocols may vary. So if you've got it in your workplace or your service, check that. Now, very important, some people with chronic lung conditions may normally run lower readings. For example, emphysema, COPD, lung cancer, or chronic respiratory disease. So if the patient is awake and able to talk, ask, do you know what your normal oxygen reading usually is? Because chances are they do it routinely and know it. Their usual baseline can be incredibly helpful. Now, why is pulse oximetry useful in first aid? Well, it can help us assess a whole bunch of conditions, such as asthma attacks, chest infections, shortness of breath, smoke inhalation, allergic reactions, shock, or poor circulation. It may detect low oxygen before someone turns blue or looks critically unwell. So how do you use it? It's simple. Keep the hand warm and still. Choose a finger that has no nail polish or fake nails, if possible. Place it on the finger and wait for a stable reading. But remember, the readings can be affected by cold hands, poor circulation, shock, movement, bright sunlight, even some skin pigmentation differences. So it's a tool, not magic. A pulse oximeter gives us valuable information. It doesn't replace good observation. So remember to keep looking at respiration rate, the effort in breathing, their skin colour, conscious state, and overall condition. Because one number helps, but looking at the person tells the real story.
Thanks for tuning in to the First Aid Show Daily Minute Podcast. Don't forget to like, subscribe, leave a review, and follow us on social media for more first aid tips and updates. Until tomorrow, stay ready, stay confident, because a prepared first aider saves lives.
Welcome to your Daily Minute.